Hey guys, I am Nurse Mo, and if you've been following me for a while, you know that I've been a travel nurse for about, oh my god, I'm coming up on my 4th year, since 2014. It has been an awesome, amazing experience and an emotional roller coaster too. So I want to talk to you guys about the pros and cons of being a travel nurse. So I want to start with the cons because, of course, I'm a positive Patty and always want to end on an optimistic, high level, high vibration, high frequency note. One of the cons of being a travel nurse is constantly moving around. So you're only allowed to stay in one geographic location for 1 year, and then you gotta hit the road. So that's sometimes really hard because I've taken assignments that I really love. I love the people, I love the money, I love my apartment, and then it's like I have to go. So a year can go by really, really fast. Number 2 would be a sense of loneliness. So when I lived in San Francisco, one of the really hard things for me was that I didn't know anybody. I had a really hard time meeting people, even as bubbly as I am. And it was just a sense of loneliness. And for me, that was really challenging to not have friends that I could call up and say, hey, let's grab drinks, let's grab dinner. So that was really, really, really hard for me to be in a space where I didn't know anyone and I felt like I couldn't get to know anyone. The third thing is a sense of belonging. It can be really challenging as a travel nurse to feel like you belong to a unit, to feel that sense of camaraderie in the hospital that you work at, to feel like you are a part of the team. I have literally worked at hospitals where they tell me that the food in the break room is for the staff nurses, not for the travelers. Being floated all around to different units can be really challenging as a travel nurse because you don't feel like you belong. And sometimes you feel like you get dumped on and get the patients that aren't as desirable, that don't have high-level issues, but have behavioral issues. So let's talk about the good stuff because we just can't leave it on that note. So 3 things that I really love about being the travel nurse is, number 1, the money. When I started working as a travel nurse, as an RN, I was making $23 an hour in Atlanta, Georgia. So when I took my first travel nurse contract, I doubled my income. And in the last 3 years of being a travel nurse, I tripled my income. So being a travel nurse is pretty awesome. I've lived in some really amazing apartments that were in amazing cities like Los Angeles. I lived right on Hollywood Boulevard in an apartment with a pool and everything, and I didn't have to worry about ever writing a check for rent. So the idea of tripling my income, making more money, and becoming more financially stable in my early 20s was really great for me. Number 2 would be the long breaks. Taking off between contracts is a big deal. This year, I took 2 2-month vacations from the bedside, which was really amazing because I was able to stay in California as a travel nurse, not have to relocate, and just use my free time to explore and travel for leisure. So it's a really great thing to be able to take time off because you're making a little bit more money, you're more financially stable, put that money to the side, and just be able to explore. During my downtime, I went to 7 different countries. Nothing was work related, and it was really great. So definitely the freedom to travel and to have your you time during your travel nurse breaks. The third thing that I love about being a travel nurse is experiencing different facilities and different care and the different experiences that I have with my patients in the different cities that I've traveled to. I've been able to very much so diversify my portfolio as a nurse. I've worked in cardiac ICU, liver transplant ICU, neurological ICU. I've worked in the OR, cath lab, different things like that. Assignments come up that kind of you can be a fit for that area of expertise, and I definitely suggest taking it. You may have just worked in general medical ICU, but a surgical ICU position may come up or a cardiac ICU position may come up, and you can diversify your skill set even as a travel nurse. So these are my things that I absolutely love about being a travel nurse, and a few things that I hate about being a travel nurse. If you guys like this video, give it a thumbs up. Make sure you subscribe to my channel, Nurse Mo TV.